Well, thanks to Omicron causing a record number of new COVID infections, we are near our all-time high in hospitalizations. But because Omicron seems to be causing less severe disease on average and more asymptomatic infections, how many of these people over here were admitted because of COVID as opposed to just testing positive once they were admitted for other reasons? Studies in other areas have hinted there could be a big difference. The problem is Connecticut doesn't release those data yet. So I looked into some indirect data from the Department of Health and Human Services for clues. First of all, if it is COVID itself causing a large number of hospitalizations, you would expect the overall number of hospitalizations to go up. In Connecticut, here in the blue, it has gone up, but only a bit. In the last 2 weeks, we've gone from about 80% of all hospital beds full to 83%. Even though the percentage of COVID positive patients rose here by 14 percentage points, not 3. So that means the rise is being somewhat offset by a drop in non-COVID admissions. Yes, some of that may be because those non-COVID admissions turn into COVID admissions once the people test positive. But hospital experts say most of it is because people who should be going to hospitals for things like heart attacks aren't going anymore. That's worrisome, but we'll deal with that later. We are seeing the same dynamic with intensive care beds. Since Christmas, the number of ICU beds being used by COVID patients has risen from 20% all the way up to 30%, an increase of about 90 people, while the number of ICU beds being used for other reasons here has dropped by 40. So it is clear that Omicron is causing more people to get seriously sick, but it definitely could be worse. That being said, regardless of why the beds are being filled, each filled bed is still one fewer bed available. So let's finish by looking at how many beds are left. Right now, 17% of staffed hospital beds are available. That's about 1,500. And about 19% of ICU beds are still available in Connecticut. About 170 are left. So while hospitals are certainly filling up, by no means are we filled statewide. I'm Tim Lammers, Fox 61 News.